We move on to the next session, that is candidiasis. Again, a fungal infection. The definition of candidiasis is a fungal infection caused by Candida albicans. Okay, this is the exact picture of oral thrush or the oral candidiasis. Wherever the candida is infected, based on that the name is varying. Okay, we can move on to the causative factor or the risk factors of candidiasis. The first thing, antibiotics, the side effects of antibiotics. Some of the antibiotics, if we used, there will be immunosuppression that may cause oral candidiasis. Actually, when you are hearing the risk factors, you should know the conditions or medications that weakens the immune system that leads to fungal infection. If our immunity is good, no fungal infection will be affected, right? So the antibiotics, the pregnancy also a immunosuppressive stage. Okay, our immunity will be decreased during the pregnancy. So they are in the risk of fungal infection. Then oral contraceptive methods, oral contraceptive measures. So that also a risk for the fungal infection or candidiasis infection. Then steroid treatment. One of the side effects of steroid treatment is immunosuppression. So again a risk of fungal infection. Then the immunocompromised state or disease such as diabetes, and then kidney disease, all this cardiovascular disease, all this condition the person may risk for the candidiasis or the candidal infection. Then chemotherapy, the side effects of chemotherapy is myelosuppression or the immunosuppression. Again the risk of candida. Move on to the types of candidiasis. Based on the location of candida infection, it was divided. Okay, so if the organs, eye, brain, bones are affected, it is known as the invasive candidiasis. In case of mouth, it is known as oral thrush or oropharyngeal candidiasis. If it is in the skin, candidal infection in the skin, that is known as the cutaneous candidiasis. And in the nails, it will be nail candidiasis or the onychomycosis, fungal infection of the nails. Then if it is infected in vagina, it is known as the vaginal candidiasis or the vaginal yeast infection. And if it is in the penis, it is known as the or penile area or the it is known as the penile candidiasis. Okay, so based on the location of the the site of, based on the site of infection, the candidiasis infection is divided. So it will be look like this in this picture, and sometimes there will be whitish appearance too. Okay, candidiasis fungal infection. It affects the skin, genitals, throat, mouth and other body part, that is the invasive candidiasis. Okay, so when we are looking, it will be like this. And one more candidiasis is there, that is diaper candidiasis. Commonly occurs after the use of diaper, especially in children's and also in the adult. Okay, we can see this diaper candidiasis. As a treatment, we can use amphotericin B, that is an antifungal agent, then nystatin ointment and clotrimazole ointment. The amphotericin B, that is slowly dissolved in mouth 3 to 4 times a day after meals for 2 weeks. Nystatin, that is applied, topical applied 3 to 4 times a day. Then clotrimazole also 2 to 3 times a day we are giving. As a tablet, we can give fluconazole 150 mg systemically Okay, in order to get a systemic effect, we can give the fluconazole. If the candidiasis is severe, we can give the systemic drugs. Then topical cream also we can give to the patient. Okay. Then as a prevention, disinfection is the better method in order to avoid the transmission from one person to another. And regarding the oral candidiasis, rinse mouth each feeding. Okay. We have to clean, or we have to maintain the personal hygiene. And then in case of